Well, think about what you can do in 60 seconds. Watch 2 commercials, brew a cup of tea. Well, now, thanks to a Canadian innovation, you can find out the results of an HIV test in exactly 1 minute. Matthew Clayton is the Chief Operating Officer with Biolytical, the company behind the test. He joins us in studio this morning. We are also joined by Rick Galley, Chief Technical Officer of Biolytical, and Amanda Smith, who's going to help us out as well this morning. Tell me what the test is now, this rapid test, compared to what a traditional HIV test would take.
Right. Well, in the past, traditional HIV testing has taken anywhere from 7 to 10 days, depending where you live in Canada. With our test, it is done with a single visit to a physician, and in 60 seconds, you will know your HIV status.
And it's been approved for use in Canada after it was discovered that, I mean, the efficacy or the accuracy rate is 99%?
0.96% actually. So we did clinical trials over 2 years and were approved in October of 2005. And we performed the test on over 3,500 patients and did 16,000 samples.
And before we do the test, because you're going to carry one out for us here today, tell me about the advantage. Obviously, the time is an advantage, but how is that going to translate into an advantage for, you know, Canadians?
Right. Well, the startling statistic is that 25% of the people living with HIV/AIDS do not know they're infected. And those people who do not know they're infected are 4 times more likely to infect others. So the new mantra of HIV in the testing algorithm is let's seek and treat. We need to find the people who are infected and do not know it and get them tested. So with this test, we're hoping more people will come forward for testing.
And we're going to do that by showing them how easy it is,
yes,
right, Amanda and Rick? Do you want to get started? And we'll watch. We'll keep talking while you do Well, you do your thing. So how do you get people, well, when you talk about, you know, that kind of a statistic, or the people that are walking around with it and don't know it, how do you get them in to get tested?
Yeah, so it's all about dropping stigma, and we want to really move from the stigma of HIV/AIDS to a badge of honor for your own health, to say, come forward, take responsibility for your health and the health of others, and that's being done worldwide. So we know we have around 50 to 60,000 people in our country who will live with HIV, and as I said, around 15,000 we do not know where those people are. And some of the greatest physicians and scientists working in our country know the importance of going out and finding those people. So you'll hear very often them talk about seek and treat.
We have, this is the only Canadian approved rapid HIV test, approved for use, I should say, in Canada. There are others worldwide.
There are other tests worldwide, sir. We're one of many, but we're unique in the fact that we are the fastest test in the world, and we're the only approved product in Canada at point of care, meaning it can be used with a doctor in a one-on-one setting, as you're going to see Rick do here right now. Okay,
so now what are you asking Amanda to do, Rick?
So,
just going to take a finger. We start with a finger stick, similar to what you do for a diabetes test, for example. And so Amanda's just giving us her finger of choice.
So you're just doing a little swab.
A little swab to disinfect the skin area.
And Rick's just going to puncture the end of the fingertip here. And our test is designed to work with 50 microliters of blood, which is not very much blood.
No, it isn't.
It's just a small drop of the blood from your fingertip. Excuse me. And our test is using a proprietary dye chemistry that is the property of Biolytical and been developed over the past 5 years.
And that's just a tiny drop of blood that you're now taking a swab of or putting that into
and Rick is just going to fill this this right to the black line there. Her hands are cold. It's cold out there this morning.
You don't get faint or anything, huh, man? It's a good thing it's you and not Jeff Hutchison. I think he'd faint.
Well, everyone in our company is very used to having their fingers dealt with on a daily basis.
But the whole point is that you've got this test that people can come and get done, and you know, presumably you'll want it in. Well, I know there's a push on to get it in a clinic in Montreal.
Yes. Well, I should say that right now we've been approved for 2 years, and we've been working with all the provincial jurisdictions. As you know, excuse me, healthcare is a provincial jurisdiction, so we've had to work from province to province. And I will say that really the lead has been the Ontario government with Minister Smitherman and the AIDS Bureau here in Toronto. Toronto has adopted the product. Ontario has adopted the product and will be used in 2008 in some 60 sexual health clinics across the province.
So you've got health professionals that are administering this test. This isn't something people are going to buy in a pharmacy and take home.
No, that's not the way the product is designed. We don't use a product like this for home testing because you lose the counseling component and the surveillance component. So this is what being done in the privacy of a doctor's office, one-on-one.
And I guess ultimately the test
So the test is now complete?
Test is now
Done.
complete, and there's Amanda's 1 dot, which means she is negative, and the test has been formed correctly. And if Amanda was infected with HIV and had HIV antibodies, 2 dots would have shown up on that test, giving us a positive reaction.
So, and I guess the other advantage to doing this in the clinics that you're talking about is that it not only just treatment, but starting to peck away at this statistic of how many people are walking around without. I mean, you want to get to know, right?
Exactly. One of the biggest problems we have with HIV testing is people do not come back for their test results.
Okay.
So with a test like INSTI, you are guaranteed, because you're not losing visual contact with the patient, that every patient will get their results.
And that angst time is cut to 60 seconds.
Yes, it is.
Excellent. Thank you all for coming in.
Thank you for having us this morning.
Very much.
Seamus talks with British actress Keira Knightley. She's starring in the new movie Atonement with James McAvoy. Stay with us.